Thank you everyone for being here today. I wanted to start with a raise of hands. Who here has ever Googled symptoms before? Your health symptoms, all right. And have you actually acted on that advice? Has it been reliable? Show of hands? Little bit? Very good. Well, in today's session, we're going to explore how Sutter Health and Ada Health have reimagined that exact experience and the opportunity that AI presents itself in digital patient experience. I'm joined by Dr. Albert Chan, Vice President and Chief of Digital Patient Experience at Sutter Health. Dr. Chan is translating digital health into consumer-centric patient experiences. And I understand you're practicing at Palo Alto Medical Foundation. That's wonderful. Thank you for being here with us today.
Thank you. I think I'm still practicing, but per the last discussion, I'm not sure if it's an AI or it's me, so I'm not sure yet.
And Jeff, as we heard, is leading the U.S. business of Ada Health, an AI-powered health platform that is helping millions of people around the world understand their health and navigate to the appropriate care. At Ada, Jeff focuses on establishing partnerships with health systems, payers, employers, and other digital health platforms. It's great to have you with us today.
Thanks for being here.
Great. So Dr. Chan, tell us a little bit about Sutter and some of the consumer healthcare challenges you're working on.
Sutter Health is a large integrated delivery network here in Northern California. We have over 14,000 clinicians and over 50,000 employees, and we serve about 3 million patients annually. We have a big challenge. We have so many patients across a large geographic area with a lot of different needs, from affluent patients here in Silicon Valley and San Francisco to some of our underserved patients in Del Norte and rural patients in Amador County. Trying to scale experiences that are really sustainable, really personalized, really providing the care that patients need is a challenge, and tools like AI really are trying to help us get there.
Great. And Jeff, tell us a little bit more about Ada Health.
Sure, thanks, Sarah. First of all, just once again, show of hands. Before today, or you looked at the agenda, has anyone here ever heard of us? Oh, good.
Oh, good.
I usually only get 1 or 2 hands at best, so pleased to see that. A lot of people think of us as a startup, but we've actually been around for over 8 years. We were founded 8.5 years ago in Berlin, Germany, specifically focused on building the world's most advanced AI medical engine.
That's what I'm trying to figure out.
Are we able to get the
video? Sorry, Jeff.
Oh, no worries. As it's coming up, just wait. So over the last 8.5 years, our company set out with a very simple mission to democratize access to healthcare, basically everywhere in the world. So we've employed over 120 people for the last 8.5 years. 40 to 50 of them are actual medical doctors. And what we've been building is they've been building what is now what we think is the most comprehensive medical knowledge base in the world, all the medical's content. And then concurrently, we've had a team of about 60, 70 engineers, scientists, PhDs, geneticists, building a knowledge base designed to mimic the way people think and the way doctors reason. Originally, we thought it would be for clinical decision support, but about 2.5 years ago, we pivoted more towards consumers. And if you click it one more time, I think it'll show it. And what we launched 2.5 years ago was a consumer chatbot on top of the AI platform. December of 2016, it launched on iOS. A couple months later on Android. And in 2.5 years, this has become the #1 medical app in over 130 countries. It's been downloaded by over 7 million people. We've now conducted over 11 million worldwide assessments. 20% of them are here from the US. But what we do is we just provide generic triage, like you should perhaps go to an ER or see a doctor. In working with Sutter, what we're now doing is taking it one step further, which we'll share with you.
Great, very exciting. So Dr. Chan, let's zoom up back to the opportunities for AI across your digital portfolio. We'd love to hear a little bit more about where you see those opportunities and what you're prioritizing.
Sure. So I think the fundamental challenge for healthcare delivery is really solving the last mile. So we have great clinicians, great hospitals, great clinics. How do you connect patients to those services in a robust way? I mean, any of you ever had the experience of going to a clinic only to be told you really should have gone somewhere else? Or had that ever happen to anybody, ever? Or being told, oh, well, you came to the visit, but you had to do some pre-work in advance, and we'll have to have you come back. Ever have that happen? Yeah, exactly. Okay, here's another question. Anyone ever been told by their wives that they should ask for directions instead of driving? Right? So I think one of the real opportunities, and we've really done this with Ada, is to say, can we find a digital wingman? Can we find a GPS to help our patients navigate? It's not good enough to just have those services, but actually help them find the services that would be appropriate for them, really value their time, and find the right appropriate services at the right time and right place. Because we think that leads to better care. And so similar to the GPS, ADA is really helping us do that, to really navigate patient symptoms 24 hours a day, 7 days a week, because I can only work so many hours in the day, and then provide them the right place, the right time to get care in our catchment area.
That's great. And if you could tell us a little bit more about ADA Health, Jeff.
Sure. Well, in terms of our collaboration with Sutter and what we're trying to accomplish, I'm going to start again with a question, but you ever hear the number one reason that people in America go to a doctor? Find out if they need to go see a doctor. And that's in essence the peace of mind that we bring to people. So when we first started working with Dr. Chen and his team, their objective was to say, how can we provide at least the perception of 24/7 access to triage, so that somebody, middle of the night, whenever it is, can at least get that sense of being able to get that question answered. It was very much starting to think about how do we, in this world where we're moving in healthcare towards things like value-based care, how do we support that by making sure people are going to the right, most efficient parts of the organization, and really clarifying initially the confusion over what Dr. Chan mentioned, what we call these same-day facilities. Most people don't know, do I go to an ER, an urgent care center, a low acuity walk-in center, or can it wait for a doctor? So what we've really been doing is trying to clarify that confusion with people. Too often, and I'm sure you've all seen this, but when you do go to a medical site and you want to find care, they ask you what doctor you want to see or what type of specialist. And too many times we just don't know that.
And you guys are doing now, was it more than 100 assessments a day with the Sutter organization?
That's true.
Yep.
Yeah. And tell us about the motivation behind doing this.
Well, think about this. I mean, by the way, our design is actually not necessarily limited to the patients of Sutter Health. We've actually made it on our public-facing website because we believe in improving the health of our overall community. And that's been a key tenet for ours, and helping people navigate to services, whether it be stay at home or come to our care facilities. That's the right thing for us to do. And one of the other things that really appealed to me about ADA really was, as Jeff said earlier, this started out as a platform to help doctors try to figure out rare diagnoses or difficult diagnoses. Think about that, giving patients the ability to have the power, the tool of having 40 doctors in their back pocket to try to give them advice when we can't always be there for them. That's an incredibly powerful proposition for people.
Can we just go to the next slide? I'll share some of the results. I think.
Yeah.
Oh, yeah.
Just a little bit just about our platform. I mentioned this already before, so we'll just fly through it, but it gives you a sense as to how serious we take this. But I think if you go to the next slide. So a little bit about the results that we've seen. We just launched with Sutter, I think it was a little over 9 weeks ago, and the feedback has been tremendous. As Dr. Chen mentioned, it's accessible on the homepage, accessible throughout the Sutter website, it's accessible throughout their patient portal, they're promoting it to patients. And what we've seen is we've seen over 9,000, almost 10,000 assessments already. And the most astounding stats that I have up here are that over 60% of those assessments are being conducted in what I would call kind of off hours, meaning when the doctor's office is typically closed, specifically between 6 p.m. and 9 a.m. And then the other astounding thing is that 50% of those over 9,000 assessments are resulting in a recommendation of non-emergency care. So if you stop for a second and think about the impact on the industry and all these things we're trying to move and shift the U.S. healthcare system, if we can successfully redirect that 50% of that population that would have gone to an ER, an urgent care center, or something like that in the middle of the night, and get them into the right part of the Sutter system, either a telehealth consultation or a mental health visit or a primary care specialist visit, then everyone's won. The system, the patient, Sutter, and kind of that's the way we all see it coming together right now.
That's great. And I know you're passionate about the opportunity for each of us healthcare consumers to have access to physicians. And if we think about having a doctor in your pocket, tell us a little bit more about what you think this means for your patients when you know that 9,000 or 10,000 assessments have been done and these kinds of findings are.
Well, it makes me feel good. I mean, we all know Dr. Google, and we've all had patients come in with a few reams of things to review with them. Wouldn't it be nice to have a tool that actually been vetted by and built by doctors, 40 somewhat editorial staff doctors, to help our patients out, give them the right answers? Because it takes so much effort to really unwind when you get bad advice. We really do want to give them good advice. And it's like having an extra members of your team to take care of your patients. It's an incredibly powerful thing.
Yeah. I personally have already used it and I found it very helpful. So again, for those of you who have yet to check it out on Sutter's website, you can do your own health assessment using the ADA platform. So in that light, we'd love to hear a little bit more about some of the highlights, the takeaways on selecting the right partner and gaining internal support to move ahead. So go back on your journey before all of this and give us a little bit of insight into that.
Oh, so there are a couple key tenets I thought was useful. First of all, medicine is not a cookbook thing, and often diagnoses take quite a bit of reasoning. And so one of the things that's highlighted in this slide in purple is how the system works. It isn't sort of a yes-no simple flow tree diagram. It really takes the nuances of people's descriptions of their symptoms and tries to give you the probabilities, because it doesn't replace the doctor. What it does is it gives you a probabilistic list of potential diagnoses and gives you the route by which you can address those concerns. That was much more reliable to me than other systems that we saw. That was one key piece. And another key piece is this. This is an article that was published about what would ADA do if you gave it rare diagnoses, hard, if you will, hard cases, if you will, Dr. House. Not that I look like Dr. House, but Dr. House, and what would happen? And Jeff, you shared this article with me that it was much quicker at actually getting the diagnoses.
Yeah, I mean, basically this was published about 6 to 8 weeks ago in Orphanet, which is a journal of rare diseases. There's about 7,500 rare diseases, and often they're not diagnosed because they're not part of that just sphere of knowledge that a doctor has. So what we did was we took over 100 retrospective cases of rare diseases that on average took over 7 years to diagnose and at least 7 medical professionals. And we fed them into ADA, and we got an 88% accuracy rate. So kind of think about the impact on what that could have saved the overall system and start getting a sense where this can go.
And this is really critically important as we tested out these various tools that are possibilities for us. What we did is put this tool in front of other doctors that had credibility in our system, and said, ask it symptoms, see what it would spit out, and which of these systems would you feel reliable to you. And ADA was one of those tools, and it was in fact the clear winner in that regard. So that really helped. And as far as sort of how we got this through the governance or all these sorts of questions, really we started off with figuring out what the problem to solve was. And if we couldn't get it right, if I couldn't tell you in the elevator within a minute what that problem was, I had to start again. So we refined the message, and it was very clear. What resonated with our leadership team was this providing health to our community and helping people navigate and using resources appropriately. Because we feel like if we do the right thing by people, all the other outcomes will come. And so that really resonated with everyone. The other part was we actually had the leadership team download the tool and try it themselves. They started to believe in it. They put in some diagnoses. They said, hey, I actually have that. And I said, that's PHI. Don't tell me. Please don't tell me what you have. Please don't. But that's how we kind of started to gain energy, momentum. And everyone started to relate stories about how in the middle of the night, for their own selves, they wish they had a tool like this. And that really gave us the energy to proceed.
That's great. And you also are responsible for My Health Online, correct?
Yes.
So how does this fit into that overall portfolio?
Yeah, we have almost 1.7 million patients on a patient portal, almost 500,000 unique hits every month. And one of the things that we see today is, and I see 10 minutes, thank you. We see that people are reaching out to us each and every day. We're getting hundreds of thousands of messages annually. Actually 16 million messages annually. And a lot of them are about these types of concerns. But those concerns wait by email. So they sit, and guess what? The doctors have to read them many hours later. And what if you could have a tool that would provide that guidance right away? That's really powerful. So that's one of the reasons why we put it in front of our portal to give patients that navigational guidance. Because if you need to seek care, it'd be great to just get that advice up front. And once you get that advice and you know what to do, you'll proceed.
Very good. So as we look ahead in 2020, I'm thinking about what healthcare will look like in 2020, building on this. Could you give us a little bit of your thought around that?
Who thinks healthcare is easy to navigate? Frictionless. Raise your hand. Right, exactly. So I think, but what about other experiences? When's the last time you ordered from Amazon? Really? Come on, guys. You got to be serious. No one else ordered from Amazon? Oh, all right. Look, In 2020 and beyond, what I think it has to be, healthcare has to be much more frictionless, much more frictionless. And people deserve better quality care at a lower cost, pure and simple. And we believe some tools like this, solutions, I should say, like this, really will help us do that. Because if we can cut the waste out of the system and provide care, the right place, the right time, that'll be a benefit for all. So.
That's great. And before we continue looking at 2020, I'm thinking about the opportunity to learn from all of the assessments coming in. That's new data, new information from what you've been working with in the past. Maybe you could share with us a little bit about how Sutter's leveraging that to further improve.
Sure. So one of the other reasons why Ada was has been such a great partner is the commitment to actually learning. We don't just install software for software's sake. We really want to learn how it impacts our patients. And so we're together working on evaluations to figure out the level of engagement with patients, what time of day that they're engaging with us, what they're asking about. And we actually hope to publish this, to share this with the broader community so we can better understand how you can use AI tools like this. So instead of just learning for ourselves how to put tools like this in, we can share this with the broader population of our healthcare professionals.
Perfect. And that leads me to, what do you think, Jeff, will come from ongoing collaboration with Sutter as we go into 2020 and beyond?
Sure. One thing I just want to add to what Dr. Chan just said, though, when it comes to the data, and you're hearing this a lot today, obviously that becomes incredibly important. And the insights that we'll be able to provide over time will be able to help Sutter see, are there people that are reporting certain conditions in areas maybe where they need to expand their services into or provide additional services? Or is there a particular area they serve that is having an early outbreak of the flu this year, something like that? In fact, we just looked, and when the CDC announced the measles outbreak here in the US, we checked our data. The CDC and the World Health Organization put the alert out on April 25th. We looked at our data and we saw the week of March 20th, a significant increase in ADA recommending measles all across the US as a potential condition. So you start to think once again, just about where this can go. In terms of next steps, three major things on the horizon I'll mention. One is just continually improving our clinical accuracy. We're trying to cover all of the world's known diseases. We're adding currently about 75 per quarter. Secondly, we want to create the connection of this to the clinicians. In the first 3-4 weeks launching with Sutter, we had over 400 free text comments from users. And the number one requested feature was the ability to share this assessment with my doctors. This assessment was so much more thorough. I would love to give it to my doctors so that they can benefit from all the questions that I was asked and stuff like that. So we're working with Sutter on making that available. And then going one step further on that side, there'll be greater integration with their clinical tools. And on the patient side, think about all the other inputs that reflect your current condition. So your trackers, your wearables, your connected health devices, if you're on a Bluetooth glucometer or propellant. We've even developed interfaces to your genetic profile so you can link your 23andMe profile, because your genetic disposition is going to be a major factor in determining probabilities of certain conditions. And then once you can share that with your clinician, you'll be able to take that to your Sutter clinician, or they'll have it as part of your record, and you'll have a much more holistic, proactive view of your health.
And these are important ideas. I mean, we've actually seen this with very rudimentary questionnaires. That if you can provide these questions up front, you get the information you typically asked by doctors. The patients, we can actually be more efficient about providing care to patients, but they feel like they spend more time with you because you're focusing on the things that they're concerned about. It's really, really powerful.
Will we see this make its way into the offices when we're stopping in for our visit, filling in that infamous health history form? Do you see that potential across the organization?
Well, we put it on the face of our primary website, so we really believe in trying to get it out there and getting folks engaged. So
Great.
For sure.
Great. Well, I think we have an opportunity for questions. We'll continue if there are none, but I wanted to take a moment and pause. So there will be someone with a microphone coming around to take those.
And we got through a talk without talking about cats, so.
No cats here. So it's great to see some of these results. I think it sort of empowers us as patients, tools like this. Is there an opportunity to use the camera actually to start doing some diagnoses as well? That brings in the visual elements, things like lesions and tumors and stuff like that. That might be an opportunity.
I'll take that first.
Sure, go for it.
So on our side, I could tell you we've experimented with being able to submit images, videos, and things like that along with your assessment. And we actually found there's a lot of, I'll just say, variability in the way people can take pictures and things like that. So initially what we now do is we present the images. So we'll present images. If we're trying to get more information about a rash, we'll present images, or if it's something that we can present in a video, so that they can compare, contrast, and report and give us as close a kind of indication. But in the future, absolutely. We'd love to get to that point where they can then submit audio or video with their assessment.
Right, and in the interim, our next step really is we have a video visit service. We actually do provide 12 hours a day, 7 days a week today. So, as I said, we're not trying to replace the doctor. We're really trying to empower. So our first foray is to say, take that expert, link them up together. And in time, I do believe AI image classification will help with these sort of problems. Yeah.
So you were saying earlier that there was a 50% of instances were recommended to non-urgent care. Have you actually seen a decrease in emergency care visits?
Well, we're only 9 weeks in, so it's pretty early. I'm just saying. You'll know when we publish. How's that?
What kind of demographics have you seen using this tool so far in the first 9 weeks?
Interesting data, actually. You would presume, at least I would have presumed, it would be typically skewed towards a younger population of people, right? Apps and so forth. In fact, we had huge percentages of people who were 50 and older, 16-year-olds, 70 and older, and even some 80 and older people using the tool, which was
I think it was like, correct me if I'm wrong, it was like 30%, I think, over 50, right?
Yeah.
Yeah, 30% of our initial usage on Sutter is over 50, which, by the way, skews as an older demographic than our worldwide public app. So it's interesting to us.
Yeah. So, of course, that from healthcare professional, that could be both. Younger people don't have too many things. That's one part. But also, I think our patients are 50 and older are more engaged with our portal, for example, too. So they're more engaged and more in touch with their symptoms. So it didn't totally surprise me, actually.
And the rest of the demographics, and happy to share them in greater detail with you afterwards. But it's skewing. It's generally very typical with services like this. I'd say 60-40 female to male, or 65-35 female to male. Very indicative of the female being kind of the CMO of the household that we all talk about. And we also offer the ability, or will be offering the ability to do like multiple assessments for family members and things like that to kind of improve that.
Yeah, we're really excited about that, because right now, when you put your 80 years old, you may be asking about your father or mother. So we don't know that yet, but in time we will.
Good. I think we have time for one more question. Anyone else?
Thanks. This is really a question for both of you. I understand that currently, when you use ADA, there is no integrated handover to your telemedicine solution. Intelligently handing over from a bot towards a human can sometimes be a friction. Is this something that you're working on and that you see evolving as your partnership evolves?
Yeah, so the ultimate goal is, of course, navigation. So we think as we stratify patients to the right type of care that they need, one of the potential care options is, in fact, telemedicine. And so we want to link people to that. Of course, we're not replacing doctors, so we're giving people information and clickable choices. And that's the way we think people can, and we think people are pretty smart about it. I still believe in people. I'm at an AI conference, but I still believe in people.
And from our perspective, in our early days, we did experiment with integrating our own telehealth platform or a third-party telehealth platform. And what we decided is to really focus on our knitting. We are focused on being the best AI-based symptom assessment and care navigation platform. And we've decided to be guidance agnostic. So some of our competitors come to the table with a telehealth solution or a network of doctors. What we do is we count on partners like Sutter to deliver the care. So we will integrate and drive patients to their telehealth platform, and then we're very much data-driven. We'll start seeing how it gets used, and then whatever we can do, things like single sign-on or other types of integration to make it easier to use, we'll certainly we'll try to do together.
Very good. Well, thank you all.
Thanks so much, Jeff, Albert, and Serrah.
Thank you.
Thank you.
Wow.